So you wake up at 3 a.m. with your heart pounding. It is pounding so hard you can feel it in your chest, you can feel it in your head, you can even feel it on your pillow. Your skin is hot. You may have to get up because you need to go to the bathroom to urinate, and you feel like you cannot catch your breath. And underneath all of it, you have this strange sense that something is very wrong. You've actually been told it's anxiety, it's stress, maybe you're depressed. Maybe somebody actually told you it was perimenopause. So, this is not something that is foreign to some of the women in my practice. I've heard this complaint before, and sometimes they wake up so panicked that they think they need to go to the hospital because they're having a heart attack. So, what if I told you that it's not any of those things? So, it's not stress, it's not perimenopause, you're not having a panic attack. It's actually a measurable chemical, repeatable cascade that's happening in your body at 3 a.m. And once you know what it is, you can actually do something about it. I'm Dr. Stasha-Gae Roberts, nurse practitioner, veteran, BHRT certified, and the founder of Compassion Primary Care. So you are not imagining this, you are not losing your mind, and you are not having a panic attack, which is great news. And again, you do not have to feel like you have to prove that you're struggling to be taken seriously here. So today I'm going to teach you about mast cells. We're going to talk about what happens to you and cortisol at 3 a.m. and about why the two collide often in midlife women and it produces this awakening and this gasping feeling. And I'm going to start with the framework because actually the next three videos are going to be a series that builds on this video. So mast cells are immune cells. They're a part of our immune system. They actually live throughout our body. So you're going to find mast cells in places like your skin, in your gut. You're going to find them in your nasal passages, your respiratory tract, your blood vessels. They're even located around your heart and your brain. So as you can see, they are present all over our body. Their basic job is to detect threats and respond to those threats quickly and fast. When they detect something they consider a threat, they're going to release stored chemicals into the surrounding tissue. And this is what produces some of those responses that we're used to. That main chemical is known as histamine. And so, in a healthy system, mast cells are going to fire when there's a real reason, a real threat, and they're going to quiet down when that threat or reason is gone. In what we call mast cell hyperactivity, mast cells are firing too easily, they're firing too often, and they're kind of hanging around and staying longer and causing problems that we don't want. So, I want to be clear about something here. Mast cell hyperactivity is not the same as mast cell activation syndrome, which is the formal diagnosis you may have heard called MCAS. So, MCAS is a specific clinical diagnosis that requires specific testing and also specific criteria. A woman can have significant mast cell hyperactivity that is actually wrecking her sleep, her weight, her energy, her gut, and also her sense of safety in her own body, and still not meet the formal criteria for MCAS. So that distinction does matter. When I talk about mast cell hyperactivity in this series, I am describing the pattern. When I say MCAS, I mean the formal diagnosis. Most of the women that I see fall more into the hyperactivity category. Not all of them have MCAS. The framework still applies to both. So now let me tell you what is happening at 3 a.m. specifically. So we've talked about cortisol before. Again, it's the body's stress hormone. But again, it also plays a major role in mast cell stabilization. So when cortisol is healthy, it's going to keep mast cells calm. Cortisol follows a daily rhythm. So it is high in the morning, normal, and it gradually declines throughout the day. That's what it should do. And it reaches its lowest point between the hours of 2 and 4 a.m. That low point is supposed to be a moment of deep rest. However, here is what happens if your mast cells are already in a hyperactive state. So all day cortisol has been holding the line. It has been keeping those mast cells stable. It has been the only thing standing between you and the histamine your mast cells have been waiting and wanting to release. And at 3 a.m., when the cortisol levels start to drop and at their lowest point, the brakes come off and mast cells kind of let go and let loose. So we have a surge of histamine going into our bloodstream. So this is going to lead to our heart starting to beat faster and harder. Your blood vessels are actually going to dilate. Your skin is going to flush. Your nervous system shifts into alert, and you wake up. So, again, this is a chemical reaction. The heart is pounding, you're gasping, and you're probably convinced that something is wrong. Something actually is happening, and it is not in your head. It is just basically chemistry, biochemistry, and it is measurable. And it has a name, and these are all good things. So again, I've heard patients describe this to me and they think they're having a heart attack, unfortunately, and they go to someone's emergency room, um, and everything comes back negative, but they still have no answers. So let's talk about why this hits midlife women so hard. So this is the part that almost no one is going to tell you. So, estrogen actually can activate mast cells, and progesterone can help to stabilize them. And that is an oversimplification. It's a very complicated story that's nuanced, it's individualized, and it's dependent on many factors, which often include things like genetic variations. Here's what most women have never been told, and I have told you this before, so I would recommend you go back to the video. But progesterone starts to decline around age 35, not 45, not 50, 35. So that's often a full decade before any other sign of perimenopause is showing up. This is before you start having cycle changes, before you may start having hot flashes, and before anyone really starts to take your complaints seriously. And progesterone is what was calming your mast cells. So when progesterone drops, mast cells become a little bit more reactive. Again, histamine is being released. So if your 3 a.m. heart pounding started in your late 30s and your doctor told you that you were kind of young for perimenopause, please hear me. You are not too young. The loss of progesterone's calming effect on your mast cells had already begun. And nobody just thought to mention it. Maybe they didn't even know or think about it. And of course, there are a few other common drivers worth naming briefly. So things like stress. So years of chronic stress actually flatten your cortisol rhythm. When cortisol is dysregulated through the day, the natural balance that helps to keep those mast cells stabilized gets disrupted. So that 3 a.m. drop is going to hit harder. Post viral illnesses. So Epstein-Barr virus, herpes virus, COVID, they can also prime for chronic mast cell overactivity. And many women report that their 3 a.m. episodes started to significantly worsen or started after a recent viral infection and never returned to baseline. This is consistent with what the research is now describing about post viral mast cell activation. And then some women carry a genetic variant called hereditary alpha tryptosemia that makes their mast cells easier to activate. It can be tested for. The point is, this is not random. There are real identifiable drivers that can be causing some of these issues. And most of the time, more than one is in play. So many women with this 3 a.m. pattern have already began going through conventional medicine workup. So one of the typical things is a sleep study or a cardiology referral, the Holter monitor. Those things sound familiar? I have done all three. So the sleep study is looking for mechanical airway problems. It measures breathing and oxygen and also periods of apnea. It's not looking at histamine, it's not measuring histamine. The cardiology workup, again, they're looking for structural heart problems, they're looking for issues with rhythms. They usually are none because the heart is responding and acting in the correct manner. Again, this is a chemistry issue that needs to be addressed. Now, when we're talking about standard primary care, rarely is this investigated at all. So the combination of symptoms, again, gets attributed to things like anxiety, stress, maybe depression, probably very rarely perimenopause. So you're getting a sleep aid or antidepressant or anti-anxiety medication. And the underlying mast cell activation never gets named or even mentioned. So the interventions that actually work address the chemistry directly. So natural mast cell stabilizers include things such as quercetin, vitamin C, and luteolin, and they work upstream from histamine release. And for some women, these interventions alone help reduce or resolve the 3 a.m. episode within several weeks. Cortisol rhythm support matters. So, a healthier daily rhythm of cortisol means the 3 a.m. drop is going to be less abrupt. Things like morning light, blood sugar stability, sleep timing, stress regulation, protein, vitamin C, your B vitamins all help with cortisol regulation. Being aware of what foods may actually trigger histamine release, such as aged cheese, fermented foods, red wine, leftovers, and certain fish, and lowering these things in your diet or eliminating them altogether can also make a real difference. And here's the one that is most often missed: restoring progesterone when it's clinically indicated can be one of the biggest drivers of helping to calm down mast cell hyperactivity in midlife women. And I'm talking about bioidentical micronized progesterone specifically. So I am BHRT certified, and progesterone restoration is one of the most impactful tools that I often use to help my women overall, not just with this pattern. But again, it is individualized and it's based on a real evaluation, and it is not protocol driven, because you may have heard that there are some women when they start even bioidentical hormone replacement therapy, and if they have mast cell hyperactivity, it worsens. So it's not just throwing you on a medication, but it's looking at what is actually the driver behind this. So here's what I want to leave you with: what you are experiencing at 3 a.m. is actually a real issue. It is measurable, it is treatable, and those things are good news. You may have never heard this. The framework exists even if most clinicians have not been trained to recognize it. So your body has been telling you the truth, and the medical literature is actually finally catching up. And this is just the beginning of the series. So, again, over the next 3 weeks, I'm going to walk you through how this same chemistry can show up. And it looks like stuck weight that will not move. It looks like you're going to pass out if somebody walks by with a certain fragrance or you have a certain food reaction. And the receptor framework that helps to explain why one antihistamine alone almost never fixes the whole picture. So, if this 3M pattern sounds like what you have been living with, I would love for you to book a free, no pressure discovery call. My signature Finally Answered program is a 3-month root cause investigation built for women like you who are done leaving appointments disappointed and without any answers. Again, the discovery call is free, and it is a time to have a real conversation with me, and it's not a sales call. Please book your call. The link is in the description. Compassion Primary Care serves women in the entire state of Florida through virtual care, with home visits and in person care at the Wellness Center of Ellington in the Tampa Bay and Suncoast region. So, this is not your 20s. This is also not your new normal. And you do not have to prove that you've been struggling to be taken seriously here. I'm Dr. Stasha-Gae Roberts. Thank you for taking the time and trusting me with your time to watch this video today. I am here to assist my patients in nursing their journey to lasting wellness. Have a good one. Bye bye.